Raph, thanks very much for joining me today. Appreciate it. So maybe just to start out, just tell us a little bit about yourself and your company, CircleLink.
Absolutely. So CircleLink Health is an AI-enabled care management platform. We do follow-ups with registered nurses, teleregistered nurses, and agentic voice agents between doctor visits when patients are at home, specifically older, sicker patients with chronic conditions. We follow up with them to make sure they're healthy, their meds are reconciled, they're following their care plan, and ultimately they stay out of the hospital. This saves the system a lot of money, so Medicare and other payers will reimburse our physician partners for this service. And what makes it valuable to our customer physicians and health systems is they typically don't have the technology or staffing or kind of experience to run these programs at scale.
Right. And you've made this agentic, right? You created an agentic tool to help support that.
Yeah, we basically bifurcated high volume, lower level tasks versus high judgment, human-based tasks. So lower level tasks to be handled by a telephone agent that can engage patients and scale it without headcount. And that frees up nurses and registered nurses specifically to do higher level clinical tasks like care coaching, medication reconciliations, things that involve judgment, triage, for example.
Yeah. Okay. So tell us a little bit about how you found us, because obviously that's a unique story.
Yeah, absolutely. So my background was fintech and finance, specifically high frequency algorithmic trading. And basically, after a few years of that, I was looking at places where technology can make a big difference and kind of fragmented, highly regulated industries like finance. And I met my co-founder, who was a healthcare consulting veteran, and did some research with him about new incentives from payers to drive more proactive care instead of status quo reactive care. Through that project, we found great reimbursements like the CCM codes or chronic care management back in 2015 and decided to start CircleLink because we knew doctors would not have the time or the technology to do all these follow-ups between visits, specifically primary care and some pain specialties. They don't really have the time or staff to do it or the technology to track it all compliantly.
Got it. So we have a friend in common, who's a partner of Connex's, and obviously a friend of yours, Corey Feldman, and I think that's how we initially met, right? Corey somehow brought us up in a conversation. I don't know, you can tell us a little bit about that.
Yeah, Corey's got a great company called Protego, different part of healthcare, but also uses AI in a great way. So he basically was saying that he had engaged with a great kind of network like yourself, specifically yourself being Connex, that was really helpful in shaping his message to enterprise health buyers and also introducing him to qualified enterprise health buyers. And through that, I asked him more questions and told him I was interested in learning more because maybe it was a fit for us to get in front of the right people in enterprise health.
Yeah. So let's talk about where you were at that time. So it was 6, 7, 8 months ago, whenever it was, something like that. In terms of the business, some sort of the challenges, problems, opportunities you were looking from a sales and marketing standpoint that sort of made this make sense.
Yeah, absolutely. I think the key thing when we looked at our sales channels was that there's just a lot of good leads coming from referrals and distribution partners, and it's more challenging to have a cold entree, especially at the larger organizations where they're inundated with different people trying to pitch them or varying priorities. So the opportunity to have a trusted introduction to a qualified buyer was something that I thought was well worth investigating. So that was my initial reason for being interested.
Yeah, that makes sense. You mentioned messaging, and obviously with the new agentic solution that I believe you officially launched in September, is that right? Is that official?
We launched parts of it in September. We actually just relaunched our messaging on our website this week.
Yep.
So
that's why I wanted to talk to you a little bit about that, because obviously we had some dialogue about that.
Yes.
So give me a sense of how we helped you think about that messaging, how useful we were, how we helped shape that, didn't shape that. How did that?
Yeah, I think the main value was because you're talking to so many healthcare executives, you really have, dare I say, a lot of empathy for what they go through when they're searching for a solution. So basically, our messaging initially, although like flashy from this kind of nifty acronym, it did not help the buyer understand what we did immediately. And the buyers don't have time. They need to read a slogan, understand immediately how we can help them. So we reframed what we did to our new, we basically built a new AI platform, and now it's called Sphere CM. We have CM for care management. We also have Sphere CCM, that's Sphere chronic care management, Sphere RTM, remote therapeutic management. So for all the different reimbursement programs that we service in the care management realm, someone now can go to our website or any of our materials and know exactly what we do within a few words. And that was not the case in our prior version, which was more implicit as opposed to explicit.
Yeah. I know we went back and forth a couple of times from initial conversation, what you showed us. I think gave you some feedback, not just me, but the team gave some feedback. And then we came back, and I remember I was in London. I was in the back of a taxi, I think, and you called me or you texted me, and we had a quick conversation, and then you chatted, I think, with Sam, who was our head of research. But it was a pretty quick process. But I think the end result is a lot cleaner, crisper messaging. Like you say, that's exactly what the problem is that you solve.
Yeah, we had two other advisors help in this process earlier before Connex got involved. And I think what the difference is, the two other advisors, one was an amazing tech CEO who's now on the advisory board of our private equity investor. And he was great just from general structuring of the message, but no healthcare expertise.
Right.
Then we had a healthcare marketer who had healthcare expertise, but was not really in touch with the buyers that Connex is in touch with. And the final funnel and iteration was with you. And I think that really honed the message around, okay, you know what you do, but how do you get that into the buyer's brain as fast as possible, so they don't waste time or think you do something else. So that sounds very simple and abstract, but in practice, I think it's super important.
Yeah, agreed. So obviously, still relatively early days in the relationship, but I know you've had, I don't know how many meetings, several meetings at this point.
Yeah.
How have they gone? And also loved you to talk a little bit about the feedback, because obviously we're not passive in this process. We obviously want you to be successful in the conversations that move forward into proposals and pilots and all of that kind of good stuff. But and part of that is giving feedback. So yeah, just love you to give you a sense of that.
Yeah, the feedback has been good. We had some shifts in our sales team. So as the meetings progressed, we got some great constructive feedback from yourself, Connex, your team, which I think is helpful. Time will tell. I'd say the meetings have gotten definitely more interesting recently, and I'm feeling very optimistic about what will happen. But again, it is very early.
Yeah,
Sure.
Absolutely. I think you do have, I don't think it's signed yet, but it's a pilot, right? That's starting with a practice.
We have a verbal. I wouldn't. We're in contract review. I don't want to.
Yeah. We don't want to jinx it. I agree.
I'd rather just say I'm feeling optimistic, but we don't know until it's done, kind of thing.
It's not until the fat lady sings.
Right. Exactly.
Yeah. Agreed. Well, look, I know it's very early in this relationship, but how have things gone here? Obviously, this is the first Connexion event you've come to. So, and I know we're not finished with the event yet, but have you had some good conversations here? How have they gone?
Yeah, I had a couple of very good conversations, and one conversation led to a demo scheduled in real time. Another conversation, I think, is with kind of a motivated, not exactly the buyer, but someone who's motivated to get the right buyers involved and wants what we have at his hospital system. So those two meetings, I think, went as well as you can ask for. And then some other meetings, I think, were just kind of more into networking than we're scheduling a demo right now, kind of thing.
Yeah. That's the nature sometimes of an event. Of course, it's a bit different from a regular meeting. But yeah, well, I'm glad Things have gone well so far. I appreciate you sitting down with me today, Raf, and appreciate the partnership. So thank you.
Yeah, thanks for everything. Appreciate it.